Hello, and welcome to this presentation on the global burden of Legionellosis. I hope this information will be informative. My name is Alyssa Casio-Rizzo, and I am a Doctor of Nursing Practice candidate at Wagner College. Legionellosis is a bacterial disease caused by Legionella that can present as either Legionnaire's disease or Pontiac fever. Legionella pneumophila, particularly serogroup 1, is the most common species responsible for the disease. It is a gram-negative bacillus bacteria. Pontiac fever is milder than Legionnaire's disease and presents with an acute self-limiting influenza-like illness, with the main symptoms including fever, chills, headache, malaise, or myalgia, but no signs of pneumonia. Pontiac fever can affect healthy people as well as those with underlying illnesses, and symptoms occur within 72 hours of exposure. Nearly all patients fully recover without antimicrobial drug therapy or hospitalization. Pontiac fever was named after the city Pontiac, Michigan, where the first case was recognized. Legionnaire's disease typically presents with severe pneumonia, which usually requires hospitalization and can be fatal in approximately 10% of cases. Symptom onset occurs 2 to 10 days after exposure. Legionnaire's was named after a deadly outbreak of pneumonia in Philadelphia in 1976 among people attending the Convention for the American Legion. Both Legionnaire's and Pontiac fever are nationally notifiable diseases. The reported incidence of Legionnaire's disease varies across different countries and regions. In Europe, Australia, and the USA, it is estimated that there are 10 to 15 cases detected per million population per year. Each year in the United States, between 8,000 and 18,000 persons are hospitalized with Legionnaire's disease, according to the Center for Disease Control and Prevention. However, many occurrences are thought to go untreated or unreported. According to a recent study, the real number of Legionnaire's disease cases may be 1.8 to 2.7 times greater than what is reported. Illness is more common in the summer and early fall, although it can occur at any time of the year. As seen in the graph, since 2000, the number of cases of Legionnaire's disease reported to the CDC has been rapidly increasing. This map shows the global burden of Legionellosis. During the period between 2015 to 2019, the number of reported cases increased by 65%, showing an increasing trend in recent years. Legionnaire's disease remains an important cause of potentially preventable morbidity and mortality in Europe, and the burden appears to be increasing. However, variation in rates across European countries remain, probably reflecting underdiagnosing of this disease. Legionellosis is not contagious, meaning it is not spread from person to person. Disease transmission primarily occurs through inhaling Legionella-contaminated aerosolized water. While rare, exposure is also possible from aspirating Legionella-contaminated water or using contaminated potting soil. Outbreaks have been seen in hotels, hospitals, and long-term care facilities. Legionella thrives in warm water environments and has been found in lakes and rivers as well as in human-made water systems. Legionella bacteria can grow and thrive within a certain temperature range. They are most commonly associated with water environments and can replicate and multiply more rapidly between temperatures of 20 degrees Celsius and 50 degrees Celsius. The main sources of aerosolized Legionella include lakes and ponds, cooling towers, faucets, shower heads, hot tubs, humidifiers, hot water tanks and heaters, decorative fountains, swimming pools, birthing pools, water parks, and soil. Certain individuals are at an increased risk of developing Legionnaire's disease or experiencing severe complications if they are exposed to Legionella bacteria. The following groups are considered to be at higher risk: people aged 50 years and older, former or current smokers, people who have certain chronic lung diseases such as chronic obstructive pulmonary disease or emphysema, people with weakened immune systems. This includes individuals with conditions such as HIV, cancer, organ transplant recipients, and those taking immunosuppressive medications, and people who recently traveled with an overnight stay outside of the home, including a stay in a healthcare facility. The diagnosis of Legionellosis typically involves a combination of clinical evaluation, laboratory testing, and radiographic imaging. A healthcare provider will assess the patient's symptoms and medical history. Legionnaire's often presents as severe pneumonia with symptoms including high fever, cough, hemoptysis, shortness of breath, myalgias, abdominal pain, nausea, vomiting, diarrhea, loss of appetite, headache, fatigue, and confusion. It is important for the patient to inform the healthcare provider if they have been exposed to potential sources of Legionella bacteria such as hot tubs, cooling towers, or recent travel. According to the CDC, a urine test for the Legionella antigen and Legionella culture of a respiratory sample are the preferred tests to diagnose Legionellosis and are used to confirm cases showing typical clinical features of Legionellosis. The urinary antigen test provides results within a few hours and is highly sensitive and specific for Legionella pneumophila serogroup 1, the most common cause of Legionnaire's disease. Culturing Legionella bacteria is considered the gold standard for diagnosing an infection caused by Legionella bacteria. A positive culture may be determined in about 48 to 72 hours. A sample can be obtained from respiratory secretions or lung tissue. Blood tests can detect antibodies produced by the immune system in response to a Legionella infection. A significant rise in antibody levels between acute and convalescent samples collected 2 to 3 weeks apart can indicate recent infection. Serologic testing is more useful for retrospective diagnosis and surveillance rather than for immediate patient management. Radiographic imaging, such as chest x-rays or a CT scan, may be performed to assess lung involvement. Typical findings in Legionellosis include patchy infiltrates or consolidation in the lungs. The treatment of Legionnaire's disease involves the use of antibiotics to target the Legionella bacteria and supportive care to manage symptoms and complications. Prompt initiation of treatment is crucial to improve outcomes. The specific choice of antibiotics may vary based on the severity of the illness, the patient's health status, and local antibiotic resistance patterns. The antibiotic of choice for treating Legionnaire's disease is usually a fluoroquinolone such as levofloxacin or moxifloxacin, or a macrolide such as azithromycin or clarithromycin. Supportive care is important to manage symptoms and complications associated with Legionnaire's disease. It may include measures such as adequate hydration, antipyretics to reduce fever, and pain management to alleviate discomfort. Severe cases of Legionnaire's disease often require hospitalization, especially if the patient has significant respiratory distress, hypoxemia, or other complications. Hospitalization allows for close monitoring, administration of IV antibiotics, and necessary supportive care. Preventing Legionnaire's disease and slowing its global spread requires a comprehensive approach that focuses on multiple aspects of Legionella control. Here are some key measures that can help prevent Legionnaire's disease and slow its global spread. Regular maintenance, such as implementing routine maintenance and cleaning of water systems to prevent the buildup of biofilms and reduce the risk of Legionella colonization. Maintaining appropriate temperatures in water systems, such as keeping hot water above 50 degrees Celsius and cold water below 20 degrees Celsius to discourage Legionella growth. Water treatment and adequate disinfection is another key part of prevention. Consider using disinfection methods such as chlorination, UV light treatment, or copper-silver ionization to control Legionella bacteria in water systems. Conducting periodic risk assessments of water systems and implementing regular monitoring of water quality, including testing for Legionella bacteria. Public health measures such as surveillance and reporting are important to establish robust surveillance systems to monitor the incidence of Legionnaire's disease and promptly report cases to public health authorities for an appropriate investigation and response. When there is an outbreak, conducting thorough investigations of Legionnaire's disease outbreaks, identifying the sources of contamination, and implementing control measures to prevent further spread. Educating the public, healthcare professionals, and facility managers about Legionnaire's disease, its transmission, prevention measures, and the importance of prompt reporting and response. And finally, developing and promoting internationally recognized guidelines and standards for the prevention, monitoring, and control of Legionella in various settings, including healthcare facilities, hotels, and other high-risk environments. When managing Legionellosis, it is crucial to rely on evidence-based guidelines and recommendations established by reputable health organizations. These guidelines are developed based on scientific research and provide the most effective and reliable approaches to diagnosis, treatment, and prevention. Here are some key recommendations for managing Legionellosis based on evidence-based guidelines. Timely diagnosis is important to ensure best outcomes for the patient. Utilizing validated diagnostic testing such as the urinary antigen test and culture. Using appropriate antibiotics based on susceptibility testing and local resistance patterns. Implementing water management programs and conducting risk assessments, especially in high-risk environments such as healthcare facilities, hotels, and other settings with susceptible populations. And most importantly, staying up to date with current guidelines from your local health department. If you're looking for more information, please check out the following links from the CDC, World Health Organization, and the Cleveland Clinic. Thank you for listening to this presentation. If you have any questions or comments on this video, you may email me at alyssa.casiorizzo@wagner.edu. Thank you for your time.